it's a coronavirus day 451. And of course at the Angelo. Due to risks and a possible wave 4 and also the Delta wave threatening us, please do not have any gatherings above 5. Anyways, China's cases is and 663 affected. Somewhat, this is the lowest actually. Thinking about it. Since the start of this year, and today's cases are from 115 is from Toronto, 112 is from Peel Region, 59 is from Niagara Region, 47 is from York Region, and 40 is from Ottawa. All other regions have reported under 40. So 10 deaths have been reported today, and of course, variants. So the UK variants, aka Alpha, and oh, 131,991, an increase of 800 plus 868. Now, South African variants, aka Beta, also is at 1,076. Plus 41. Brazilian variant, aka Gamma, is like 3,740, an increase of a plus 477. And the Indian double-mutant variant, which is also known as like the nickname Delta, and our new latest threat, actually. So is that like the Peel region reported 97. Thanks to Dr. Dr. Lawrence Lowe and Dr. Peter Juni, the scientist, the health scientist guy who warned us about possible wave 3 and and now wave 4. So So vaccinations, if you want to sign up, 12 and up right now, you can pre-book your second shot if you are 70 plus, and last week, 80 plus, they were allowed to pre-book their second vaccine shot, and just mentioned, and if you got your vaccine shot, your first shot of the AstraZeneca vaccine, you can book at. You can get your second shot as the Pfizer BioNTech vaccine or the Moderna vaccine instead. So you can do it online, covid19.ontario.ca/book vaccine, by phone 1-888-999-6488 at a pharmacy. You'll have to wait through local health units, and vaccine bookings for 12 12 to 17. They can also do it through special youth and family clinics. There's that, and especially on Tuesday. Also at pop-up clinics, mobile clinics, and walk-in appointments on Tuesday. Youth not age 12 can book for a later date, pre-book. 1-833-943-3900 or through public health units. So the 11-day prior rules are still in effect. And now what I want to talk about is most labs in Canada are not fully able to detect India double-mutant variant of Delta 8, or its nickname, known as its nickname Delta variant. Warned by experts. So Dr. Lawrence Pelletier, who is a researcher for the Lundfeld Tenenbaum Research Institute at the Mount Sinai Hospital. The public health units across the provinces are, for the most part, not equipped with testing equipment that can fully sequence or identify some coronavirus variants. And of course, it's the double one is the Delta variant, which the India double mutant variant. Dr. Lawrence Pelletier and Dr. Jeff Rana, who is also a co-researcher, they said the number of mutations in a Delta variant make it very difficult to test it properly to identify it, since it is India double mutant variants, hence the name double mutant variants. And the double mutant variant, some part of it makes it hard for vaccines for vaccines to actually beat the virus variant, but it's been proven right now that vaccines do work. So, however, the problem is the majority of public health labs are using more conventional PCR tests that are limited to only being able to look at one or two specific mutations. While this system only works for like variants of like the UK variant, aka Alpha, through its nickname. So those with three or more, yeah. So like the India double-mutant variant that they can't trace that. So that is the problem at hand. Dr. Pelletier's the obvious answer to that is no, there's not enough variant testing across Canada, and not even in Ontario, to be honest. And he's working with alongside Dr. Rana and Dr. Tony Mazzulli, just trying to screen over 11,000 positive cases from across the GTHA. So. And which brings me to having to mention Dr. Lawrence Lowe, the official officer of health in Peel Region, Mississauga, Brampton, and Caledon, and other parts of Peel Region. So apparently, with the he mentioned how the India double-mutant variant is taking over, like outnumbering, increasing daily. Beating the official number of the UK variants in Peel Region. So this is a major concern, and what the major concern is, Peel Region is at way serious than the rest of Ontario, like about 3 weeks ahead. So that so he and Dr. Peters Jr. have requested the government to send many vaccines to Peel Region to deal with this Indian double-mutant variant problem. So it doesn't affect so it won't surge across the rest of Ontario. So deal with that problem first in Peel Region. No, the rest probably won't get affected much. So Dr. Pelletier and Dr. Rana mentioned that with the use of a new testing method that uses robot and sequencing a platform called SPAR sequence, it's been revealed that the Indian double-mutant variant, Delta, had accounted for about 20% of new positive cases, just based on their data, which is probably in which most of them is Peel Region, with the possibility of that number being much higher. And yes, Dr. Peter Juni has mentioned, and Dr. Lawrence Lowe has mentioned this. Yes, it's going to outnumber and it's going to leak to be the new or major concern instead of the UK variant, which will be probably knocked down in a second. So that's still not like bad news, like though. So Canada's you know, the Officer of Health, Dr. Teresa Tam, she had also she mentioned how like Canada is doing some sequencing than other countries. But the but still, there's that concern at why aren't they they're like sequencing tests that and all that because we know what Pure Region is in trouble, but what about other parts of Ontario? So Dr. Gerald Evans, who's in charge of infectious disease at Queen's University, he said the lack of the Delta variant, lack of the N501Y mutation, and the inclusion of the E484Q and L452R mutations are made it hard for labs to screen the Delta, the double-mutant variant. So, which it's sort of different that we need to. So what they need to do is get different screening processes. Instead of the ones that you're using for the UK variant, South African variant, and Brazilian variant, because those three variants have the N501Y mutation in it, but the India double mutant variant does not. So this is why I have to come up with new stuff. And Dr. Evans did say that due to like since we're already in the third wave, and this could get worse. But thinking about what Dr. Lawrence Lowe and Dr. Peter Juni said, it's a major concern. And I'm thinking of it, like Brampton reported that there's 36. Ottawa reported there's 141 with additionally 2 deaths. But there was that 45 where we didn't really know where it was from, and they never really told us. I looked everywhere, and there was like nothing, absolutely nothing. So due to like how it's just so hard to like screen, but now Pure Region has that now reported 97. It's just dang completely dangerous that way. And that's this is the variant that got India stuck in an extremely dangerous second wave of coronavirus with coronavirus cases and the introduction of the India double-mutant variant. So we shouldn't really treat this like a small threat, but there's proof that it's going to by Pure Region that it's going to be like it's going to increase. And if Ontario doesn't like already and Canada doesn't get screening for all all parts of to detect the India double-mutant variant or Delta, we're in trouble. So if there's like a major problem that's going to affect everybody, we better find a solution to fix it. Just a reminder, EMCPA, the officers have the authority to break up gatherings of more than 5. $750 per person, $880 if ride checks if they're still in effect. $1,000 for preventing others from following orders, and $10 million for those who organize or plan the gathering, and $1 million if severe and possibly jail time. All hospitalizations are at 545. Surprising. Minus 80. 510 patients in the ICU. Minus 6. Then 344 ICU patients using a ventilator. Minus 18. So all lowering, decreasing the death. Oh, better than April, better than May. Okay. Improving, though, good. Good. So, long-term care home, that is 3,777, which I hope it did not, which is just another major increase. Staff stats have not changed, still at 13. And 26 outbreaks, still at one higher than yesterday's. So please follow coronavirus safety rules and regulations and 11-day rule. Do not have gatherings over 5 for the safety of others. If you haven't signed up for vaccination, please do it. Stay safe.